Island reporting more coronavirus cases per capita than any other state in the country. I'm Mike Montecalvo.
And I'm Shannon Heggie. According to data released from the Centers for Disease Control, the state averaged about 110 daily cases per 100,000 people in the past 7 days. Minnesota and South Dakota are the only other two states in the country with 100 or more. By comparison, here in the Northeast, Connecticut is seeing 60 new cases per 100,000 people, and Massachusetts 58 new cases. This comes as Rhode Island reports another 35 people have died after contracting the virus, and 422 COVID-19 patients are in the hospital. 12 News reporter Brandon Truitt spoke with the Department of Health. They say the numbers aren't surprising. And he joins us now live from Providence with the details. Brandon?
Well, Mike and Shannon, the state says this is exactly why we are in this 2-week pause. Right now, the Department of Health strategy is really focusing on keeping people from gathering and moving around. Rhode Island finds itself at the top of a list many are looking to avoid. The CDC placing the Ocean State first in the nation for the average daily cases per capita.
We saw this coming.
Dr. James McDonald with the Rhode Island Department of Health says there is more to the numbers, but the picture needs improving.
We're doing a lot more testing than other states are. We're always #1 in testing, so we are finding more cases.
Pair that with the fact Rhode Island is the second most densely populated state in the country, but it's not the case numbers the state is focusing on.
It's the hospitalization number that I follow very critically as well. We're number 20, which still isn't where I want to be.
McDonald saying Rhode Island is seeing substantial spread in households from one family member to another. The state's most recent guidance urges people to keep it to those you live with, all in an effort to keep people from jumping from social group to group.
There's a lot of partying that goes on in the streets and after hours, after the bars and stuff. I'm not surprised, no.
People we spoke with today reacting to Rhode Island's ranking, some saying the state is doing what they can.
We need to change our habits a little bit. This is all going the wrong direction.
I talk to people who don't wear their masks, and it's absurd. They just won't back down.
And Dr. McDonald says we will start to see the expected surge from the Thanksgiving holiday by the end of this week. That happens to be the exact time when this 2-week pause is scheduled to end. Live in Providence, Brandon Truitt, 12 News.
First tonight, Rhode Island's infection rate is now among the worst in the country, according to the CDC. I'm Shannon Heggie.
I'm Mike Montecalvo. We are halfway through the 2-week pause, and today the health department reported more than 3,300 new cases and the deaths of 35 people since Friday, along with revised numbers showing the state hit another daily record last Thursday of more than 1,600 cases. According to the CDC, Rhode Island is averaging more cases per capita than any other state, and it's one of only 3 states with 100 or more cases per 100,000. 12 News reporter Brandon Truitt begins our in-depth coverage. Brandon?
Well, Mike and Shannon, the state says they saw this coming, adding it is exactly why we are in the middle of that 2-week pause.
But right now, we're in a very difficult spot in our state, and we need everyone to help out and do their part.
One of the state's leading doctors with a reminder that we are all in this together.
Rhode Islanders, we live with each other. You know, we're the second most highest densely populated state in the United States.
It's just one of the reasons Dr. James McDonald says the state found itself here at the top of the list for the average number of daily cases per capita.
We saw this coming.
McDonald says Rhode Island is leading the nation in the number of daily tests per capita, and they're adding more to it. The number he's eyeing closely, though, hospitalizations. Rhode Island currently 20th there.
That's a number that really indicates how well the state's doing and how much disease is really hurting us in the state.
I'm very frustrated.
The national spotlight not sitting well with those we spoke with today.
The state's doing pretty much all it can. It's people.
I want to get the hell out of Dodge. I'd like to move to another country right now.
The state saying most of the cases are coming from inside the home, people leaving their household and going to another, picking up the virus along the way and bringing it back. The state is halfway through its 2-week pause, restricting some businesses, closing others until the end of the week.
This is not the forever state, the pause. In other words, this is just for now. And I think it's important just to have something to look forward to. I think we are going to be in a much better place come Memorial Day. I think we're going to be in a much better place for that. I think the pandemic could be behind us by then.
So the question is, of course, what happens between now and then? We know that the state is increasing its testing capacity. Both field hospitals have patients in them tonight. Rhode Island very much in the thick of this pandemic. Live in Providence, Brandon Truitt, 12 News.